Hi everybody, hi family. My name is Antoinette Hunter from Amazing Growth. If this is your first time watching me, you are very welcome. On today's video, I am going to talk about key warning signs of autism spectrum disorder. Usually, before a parent starts thinking about searching for the key signs of autism, they're asking questions to themselves. Does my child have autism? Now, how do I know if my child really has autism? So all those questions going through your mind, I am here today to answer some of the questions that you have. How do I know if my child has autism? Understanding the signs are important. Autism spectrum disorder can look quite different depending on the individuals, but there are some common signs that support the diagnosis. For many parents, the first sign that causes concern are when their child is not developing speech and language skills or expressing interest in interacting with others. So if your child is not expressing interest, it's going to cause an alarm in most parents, but that doesn't necessarily mean that your child have autism. So I'm going to give you a few other signs. I'm going to give you 10 key signs of autism that you should look for. The first one is your child is not turning around if they hear the sound of their parent's voice. The second one is not responding to their name. Third, not looking people in their eye. Number 4, not babbling or pointing by age 1. 5, delay in reciprocal play and engagement. That means your child is not engaging, your child is not doing a back and forth play. That's the reciprocal play or joint attention play. Number 6, your child doesn't seek out same age peers. So they don't play with other kids. They like being by themselves. They just want to do what they're doing all by themselves. Number 7, your child does not smile or respond to social cues from others. So if there's something going on that's funny where their friends are playing or they see something that's interesting, usually other kids would show interest. But if the child has autism, they're usually very reserved. Number 8, your child does not follow along with other children or social routine and activity. So they're not following through with social routine and activity. Number 9 is meltdowns. Meltdowns are very common with kids that have autism. Number 10 is restricted or repetitive interest and behavior. That's the number 10. Now, in addition to impairment in social and communication and interaction skills, some individuals with autism display behavior that may be further exacerbated social difficulties. So I'm going to give you some of those behavior. Individuals with autism display behavior that further exacerbate social difficulties. This includes waving hands or arm or using an object over and over again in the same specific way. So usually, based on my experience with children with autism, sometimes they'll have a car and they'll turn the wheel over and keep spinning it over and over again. Sometimes it could be block. They'll stack that block over and over again, or they might be holding an object. They'll just keep flipping the object and looking at the object for a long period of time. It could be, some of them can stay there for about 20 minutes, 30 minutes, or for some kids even longer. The next one is rigidity, which includes becoming unusually upset or distracted over minor changes in their environment or daily routine. So usually the kids that have difficulties with autism or struggling with autism are very much into their routine, and they want their routine in a certain way. You cannot just go in there and change their routine, even if it's very minor. They become very protective and look forward to that routine. So if you don't want to ruin their day, please do not just go in and change their routine without having a conversation with them or prepare them for it. That's a different, that I'll talk about that on another video. Okay. You may also observe your child insisting following strict and self-imposed routine. You know, I just mentioned that. Do not go in there and try to just move their routine or try to direct them and tell them exactly what you want them to do. Autistic kids do not do well in an environment where it's totally controlled and very strict. It takes time for you to build that routine. So they're not getting into your world. You are getting into their world. So it's very important that you keep that in mind. Those are my babies. I deal with them every day. So I know you parents, you're the first teacher. You know more about your child. And I really like that when I see a parent really understand their child. But if you don't, you can always learn by watching my videos and doing your own research. It will give you more understanding as to how to deal with your child. Some children actually, they develop unusual, strong interest in with a very specific object. So they can get an interest in an object that they really like, and they want to keep that with them all the time, or conversational topics, and maybe unwilling or uninterested in talking about anything else. Whatever you're trying to say to them, if they want to tell you about, there is this character called Huggy Wuggy, I hope I'm saying it right, and they will just keep saying it, Wuggy Wuggy, I love Wuggy Wuggy, Wuggy Wuggy, stop. They'll repeat that over and over again. So even if you're telling them something else or you're trying to gauge their interest in discussing something else, they might not be interested in it. When you ask them questions, they're going to repeat what they have learned or capture from a previous experience. I'm going to also make a video on explaining how you can help your child with all of those difficulties and challenges, but for right now we are sticking to the key concept, the key signs of autism. Next, repetitive specific motions. You'll be rocking, spinning, and hand flapping is extremely common with kids that have autism. When they are flapping their hands, they can be rocking back and forth, they can just be spinning, okay? Repeat repetitive words or phrases that were said to them, like echolalia, is common with kids that have autism, meaning they'll just be saying something that they have actually probably picked up from somewhere or previous experience from somewhere, okay? Again, scripting words or phrases that they have heard in the past, such as it could be from a movie or in a specific situation that they have encountered. Getting upset by transition or tasks done in a different way other than expected. You don't want to do that again. When you change their routine, you don't want to change their routine or giving them a task that's not expected. You don't want to do that. When you start seeing those signs, then you know that, okay, this is some of the sign that I should be really paying attention and try to see how to fix it, how to get help. Fixation on usual objects. They're fixed on a particular object, or when they're doing something, they are fixed on that thing. It's not just easy for them to just turn around and pay attention to you. Auditory aversion to loud noise and tactile aversion to certain clothing or texture. Very, very important for you to pay attention to that. Sometimes the child will close their ears when they hear certain sounds or music. That means that they don't like that sound or music. Some children will run away and hide. Some children will make noises and hum back and forth. Some of them can become very aggressive and want to fight or even hit you or scratching on your face. It's not that they're trying to be mean. It's just that they cannot handle the sound that they're hearing. That's the reason why they're closing their ears. So when you see those signs, those are really very key signs for you to pay attention to, so that way you can get help. Visual interest in looking at objects from different angles. They like to look objects from different angles. If you give them a 3D object, some of them are so gravitated towards 3D objects that they will flip it over and over again and look at it. And some children, it's a book. It could be as simple as anything, okay? And they'll look at that thing from a different angle. You need to learn to get into their world. But what we're talking about today is the sign for you to pay attention to, so that way you can get services for your child. If you think that they have autism or they're developmentally delayed, either way is for you to make sure that you get proper help for that child. We've spoken about all of the signs. You might be saying to yourself like, okay, now that you've told me about all the signs, what do I do next? So it is crucial to know the warning signs of autism so that you can determine if you should seek professional opinion from a qualified professional, okay? Because you just don't want to sit back and not do anything about it. If your child is on the spectrum, keep in mind that an official diagnosis is more than a label. So they're not just labeling your child. So it's a gateway to get your child help. Various health professionals, they're coming together to make a decision to give you the correct services that your child needs. So most of the time, they will give your child a developmental therapist, which is me. If you live in New Jersey, they're usually known as the DI. So the DI comes in and work with your child, do play therapy with your child, and follow the goals from the IFSP. That's on a whole different video. We're going to talk about that on one of my videos. So they might give you speech. If you need speech, they'll give you speech. If you need OT, which is occupational, they'll give you occupational. But at the end of the day, I have seen kids improve. So don't be afraid. Don't get scared. It's okay. There is help out there. Lots of help. And also, there are so many apps that you can use that would help you too. Autism apps. Just download them and let your child play with it. Okay? I hope this video helps. Thank you for watching.